I would wish that every family going through a cancer diagnosis, that they would have the benefit of what we received from Climb for Cancer.
Climb for Cancer is a group of remarkable individuals who have a passion for climbing mountains. And they have combined that passion with an equally strong passion for helping others who are facing a different kind of mountain, the challenges of cancer and the arduous treatments for cancer.
No matter what we do or how hard we work, we always feel like we could do more. We always feel like we need to raise more money because there's always a need.
Sometimes I have to pinch myself because I had never raised a nickel in my life. Climbing was a hobby. I'm very proud of what we've been able to do, but as Diane says, it's never enough. I climbed Aconcagua, the highest mountain in South America, a 23,000-foot mountain, and raised money for the American Cancer Society in Jacksonville. I climbed the highest in North America, Denali, up in Alaska, and raised $25,000 for American Cancer. We got our 501c3 in September 2003. The rest is history. We got to a point where we said there's so much need right here in our own community. We stopped trying to support all these different cancer centers, and 100% of the money that we donate stays here at UF Health.
Ron is just the most wonderful, giving human being you'll ever meet. He immediately makes people feel comfortable. Not only does Ron fundraise and do the things that he does to support all of the initiatives that we have in our hospital, he also is on the units, working one-on-one with children and families. And so he knows the struggles that they face, and he knows what they go through on a day-to-day basis. Sees it in a way that most people don't have the opportunity to see. And then he takes all of the things that he learns from children and families, and then he remembers that. So when our grant requests come through, he understands why those things are so important to fund.
The most common cause of childhood cancer, acute lymphoblastic leukemia, one of the drugs for that costs for a treatment course is $160,000 just for one of the medicines. And we use 13 medicines. They're partially covered by insurance, but not completely. So to treat a patient with cancer when they're a child, they require a lot of supportive services. So Climb for Cancer plays a major role in providing support for these people who provide that top-notch care.
Started raising money any way we thought we could. We got a board together who provided us ideas. We realized soon that the amount of money that we raise wasn't going to have an impact on research. It wasn't going to cure cancer. But where we could make an impact was helping patients going through treatment. And we found a variety of ways to help patients and their families. One of the best programs is Harriet's Helping Hand, named for Ron's sister who passed away from cancer. It provides gas cards, lodging, Uber rides, and meal vouchers to cancer patients and their families who are being treated here at UF Health.
The importance of an early gesture can make all the difference in the world for a person struggling with cancer, just knowing that someone is out there that cares for them.
In May of 2017, our son William was diagnosed with acute lymphoblastic leukemia. Complete shock to all of us. This was certainly out of left field. We checked into UF Health, Shands Children's Hospital, Monday evening, and by Tuesday at noon, Ron Farb was at our door. Countless times, Ron would show up at the pediatric infusion clinic. He would have a cart full of healthy lunches for parents and for patients who were there all day that would feed not only a hungry parent or a hungry child, but would feed you emotionally, really, to be able to provide that sort of support at a time when a family is so incredibly overwhelmed already. There's no price you can put on that.
Ron and Diane are an incredible couple who have dedicated their lives to supporting local, underserved cancer needs. It's also an underserved need on fertility preservation because many physicians and nurses and healthcare workers aren't aware this is even an important issue. 2 years in a row now, we've gotten funding from the foundation for a CME meeting for healthcare workers. Because of what they're doing, it's grown to be a very important outreach service.
Another program is a camp for children with cancer, a sports camp. The university gives us the football practice facility. They do basketball, and then they also do soccer. It's a day where the cancer kids and their siblings can forget about cancer, forget about their bald heads and their missing limbs, and just go out there and have fun.
Patients who had battled cancer and had been cured later were exhibiting signs of stress, anxiety, and even depression. Climb for Cancer stepped up and developed a stress reduction intervention and exercise module. It's extraordinarily successful.
One of the events called 50-51, putting a team on the high point of every state over a period of 2 or 3 months. It started to get national sponsors for this event.
We offer scholarships to cancer survivors going into the healthcare field. We have tremendous support in this community. We've raised about $2.5 million.
So the website, climbforcancer.org, you can learn about any upcoming events we have, read some news, how the dollars are being spent that our donors provide to us.